You're watching CTOM TV. Knowledge is power.
Basically, what happens in cancer cells is it's probably about 12 or 13, maybe 14 different pathways that cancer cells shut down in our cells, and they shut them down. And what these pathways do is they inactivate the immune system. In other words, there's about 12 to 14 different pathways that cancer cells can manipulate to hijack the immune cells. And the reason they like to hijack immune cells, they want the immune cells to come into the tumor, and then they want to turn them off, because then the immune cells will supply them with growth factors and proteins and all kinds of different things called cytokines, different things that they need to grow. So immune cells and tumor cells have a lot in common. They both use a lot of the same resources, the same growth factors. And so because of this, cancer cells have evolved to adapted to hijack the immune system. Typically the T cells are what they like to hijack the most. And so one of those pathways is called the PD-1 pathway, programmed death 1. So what cancer cells do is they will produce a lot of this PD-1 protein. So the PD-1 protein is something that is on the outside of a cell, and you have to have this PD-1 protein to protect your cells against the immune system. And if you don't have it, then the immune system will typically attack that cell. I'm talking about this in a very simplistic, general way. I'm not going to get into the heavy details of immune therapy, because we'll be spending hours talking about the interactions and the different receptors and so on. So in short, can you go back, please?
Oh, sure. This was just a slide about PD-1.
Yep. Yeah. Okay, great. Thank you. So in short, there's a few things and we will talk about PD-1 in this next slide. I just wanted to mention a few things before we get into that, but there's a few different pathways. PD-1 is one of them. CTLA-4 is one of them. And those are two pathways that we now have drugs for. So in other words, what happens is the cancer cells shut down the immune system using those two pathways, and the drugs we have reactivate those two pathways so the immune system can recognize the tumor. And now, this all came about in melanoma. These drugs were first developed in melanoma. And the reason is that melanoma cells, as I mentioned, there's some unique features about melanoma cells or melanocytes. They're slightly different from other cancers that typically happen in skin cells. What it is that there is a lot of what we call heterogeneity between the different cells in a melanoma. And so some of those tumors, or what heterogeneity means, is variation. There's a lot of different genetic variation between the individual cells in a case of melanoma. So one tumor could have a lot of different genetic features throughout the different cells. So some cells may have certain genetic features that other cells in this exact same tumor don't have. And so because of that, melanomas typically have a lot of what we call identifiable antigens. In other words, they look very different. They have a lot of unique features that, when you look at them on a molecular level, they don't look like each other. They stand out compared to other cells, which is unique for cancer. And this allows the immune system to recognize them more easily. So typically what will happen is when you start developing a melanoma, the immune system recognizes it right away. Whereas with other cancers, it doesn't necessarily recognize it so quickly. But because of this variation between the two different, or between the different individual melanoma tumor cells and tumors themselves, they stand out, and the immune system is much more able to recognize them and target them. It's just that it gets shut off by these different pathways. And so Michelle put a nice note there that we were one of the first to use immunotherapy on a melanoma patient in Canada. That patient was stage 4. They had no treatment options. They had a few months to live. And it was just an amazing response. The person is still alive today and completely cancer-free, almost 6-7 years later. So since then, we've been using these drugs a lot. So you can go to the next slide now, Michelle. Thank you. So a little more specifically on PD-1, and I'm just going to move my slide over a bit so we can see this. So PD-1 is called Program Death 1, and this is one of the most successful new cancer treatments that we've had. We have these drugs called PD-1 inhibitors. So what cancer cells do is they'll create this bubble of PD-1 around them, so to speak. I'm talking more in a generalistic, simplistic term. So imagine that these tumor cells mass produce this PD-1, and a PD-1 inhibitor goes in there and mops up all of that PD-1. So now the immune system can see that. So think of the PD-1 as a camouflage for the tumor cells. Think of CTLA-4 as another camouflage for the tumor cells. And think of these drugs that inhibit them as sponges that soak up the free PD-1 and the free CTLA-4. That's much more complicated than that, but that's how I like to envision it. So we have 2 drugs for this now. We have many drugs for PD-1 inhibitors, but we also have a few CTLA-4 inhibitors. And so the combination of these 2 inhibitors can be very effective in melanoma cells. So briefly, I just want to mention something about the BRAF and about the immune therapy. So often, yes, immune therapy is used when you don't have a BRAF mutation in standard care. However, what we have found out is that it's actually a lot more complicated than that. Because of this huge heterogeneity between the tumors, many patients will have some tumors that have BRAF mutations and other tumors that don't. So there's a lot of variation in this. And we've had a few cases where, we've had to treat patients with both treatments. They've had BRAF therapy up front because they're BRAF positive, and then that stopped working because not all of their tumors were BRAF mutated. And then we had to use immune therapy, or vice versa. We've used immune therapy, and then a couple of tumors have popped up that were BRAF positive. So once again, this really feeds into the importance of precision oncology.
Thank you for watching CTOM TV. Subscribe below and stay informed.